What screening tools do mental health professionals use for eating disorders? When it comes to identifying eating disorders, mental health professionals relying on various validated screening tools. These tools are essential for early detection, guiding diagnosis, and informing treatment plans. Let's explore some of the most commonly used instruments. First, the Eating Disorder Examination Questionnaire, often referred to as EDQ, is a self-report questionnaire. It assesses the range and severity of symptoms related to eating disorders. This includes concerns about restraint, eating habits, body image, and weight. It effectively identifies behaviors like binge eating, purging, and restrictive eating patterns. Next, we have the SCOFF questionnaire. This is a brief tool consisting of 5 questions designed for quick screening. It focuses on core symptoms such as self-induced vomiting, loss of control over eating, significant weight loss, body image issues, and whether food dominates one's life. Another important tool is the Eating Attitudes Test, known as EAT-26. This self-report measure consists of 26 items that screen for symptoms related to eating disorders, especially anorexia nervosa and bulimia nervosa. It evaluates dieting behaviors, preoccupation with food, and control over eating. Mental health professionals also use structured or semi-structured clinical interviews based on the Diagnostic and Statistical Manual of Mental Disorders, 5th edition criteria. These interviews help diagnose specific eating disorders like anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder. For those diagnosed with avoidant restrictive food intake disorder, specialized tools have been developed. These assessments evaluate symptoms such as food avoidance, sensory sensitivities, and nutritional deficiencies. Additionally, the National Eating Disorders Association provides an online screening tool. This free resource is accessible for individuals aged 13 and older, helping them determine if professional evaluation is needed. These screening tools serve as initial measures to decide whether a full clinical assessment is necessary. They complement clinical judgment, physical health evaluations, and sometimes laboratory tests to check for medical complications. It's important to note that these tools are evidence-based and align with current medical guidelines. They do not replace comprehensive diagnostic evaluations, but are crucial for early recognition of eating disorders. Mental health professionals adapt these tools based on the individual's age, symptoms, and clinical context to ensure accurate identification and appropriate care. In practice, screening is part of a compassionate approach that considers emotional, psychological, and physical health aspects of eating disorders. Early detection through these tools can lead to timely intervention and better recovery outcomes. Always consult with healthcare professionals for personalized advice and support.